Hi everyone, welcome back to my channel Dr. Shahan's class, and here in this video I will tell you about H3N2 influenza. H3N2 influenza. Now why I am discussing H3N2 influenza? Recently H3N2 influenza is spreading in India, and that is why I am discussing this topic. It is very relevant and it may come in medical PG examinations. So I am discussing about H3N2 influenza. Now what is H3N2 influenza? H3N2 influenza is also known as Hong Kong flu. It is also known as Hong Kong flu. Now this Hong Kong flu is a subtype of influenza A. So remember, it is a subtype of influenza A. So question may come, H3N2 influenza is a subtype of influenza A. Another question may come, Hong Kong flu is a subtype of influenza A. So remember these two questions. H3N2 influenza is a subtype of influenza A, also known as Hong Kong flu, which is a subtype of influenza A. And what kind of illness does it cause? It causes respiratory illness in human beings. Remember, it causes respiratory illness, flu-like symptoms. I will tell you in details. So watch this video continuously. Respiratory illness in human being. Now let me show you a picture. This is a picture of the H3N2 influenza virus. This is a picture of H3N2 influenza virus. It looks like this in the microscope. Now let us come to the microscopic structure of H3N2 influenza virus. Now you can see the outside the virus we have two important things. One is hemagglutinin, another is neuraminidase. Hemagglutinin and neuraminidase. These two components, hemagglutinin and neuraminidase, they actually make the outer covering of the virus. So the question may come, outer covering of influenza type A or H3N2 influenza type A, what is the outer covering? The outer covering is made up of hemagglutinin and neuraminidase. Now, and after this outer layer, there is another layer, and this layer is known as M1. This layer is known as matrix protein M1 layer, which is there. So below the outside most layer, there is M1 matrix protein layer. And what is there inside of this virus? Inside we have RNA polymerase. Now another thing along with RNA polymerase we have to remember, that is nucleoprotein, NP, nucleoprotein. Now what is this nucleoprotein? Basically it forms the core, it forms the inside of the virus along with the RNA polymerase. So both nucleoprotein and RNA polymerase is there in the core, in the center of this virus. Now let me tell you what is the symptoms, basic symptoms of this influenza H3N2 Hong Kong virus influenza type A, H3N2 influenza. What is the common symptoms? The common symptom is fever. Common symptom is fever, sore throat, headache, and the person will have cough. The person will have sore throat, cough, fever, headache. Along with that, there is minor congestion is there, and also body ache. The person will have flu-like symptoms. What are the flu-like symptoms? Fever, body ache, sore throat, cough, exhaustion, tiredness, body ache. All these things are there in this kind of disease. Remember, in influenza A, in H3N2, that is a type of influenza A where we can see the common flu-like symptoms. Remember, this influenza is also known as Hong Kong flu. Remember, it is also known as Hong Kong flu. And another thing you have to remember, this is recently spreading in India. Now, how this virus actually spread from one person to another? So basically this virus cause respiratory symptoms, and this virus can spread from one person to another with the help of respiratory droplets. This respiratory droplets contains the virus, H3N2 virus. This respiratory droplets contains the H3N2 virus and can spread from one person to another by sneezing, and you can see the picture. Now look at this slide, you can see what we have to do and what we have to don't do. So do's and don'ts of this infection. So what we have to do, we have to wear a mask, we have to wash our hand properly, we have to cover our mouth and nostril while someone is sneezing, someone is coughing. At that time you have to cover your mouth. Another thing, you have to avoid touching your eyes, touching your nose. You have to take a lot of fluid, and you have to take paracetamol for fever and body ache. So these are the things you have to do if you are symptomatic. So remember, you have to wear mask, you have to avoid the crowded place, you have to cover your mouth, your eyes, your nose, and you don't have to touch your eyes and nose. You have to cover your mouth and nose while someone is sneezing, and you have to take a lot of fluid, and you have to take paracetamol for body ache. Now what you don't have to do, don't shake hands or use other contact of greetings. So do not contact while doing greetings like shaking hands. Do not spit in the public, and do not take antibiotic. Remember, antibiotic will not work here. Why? Because this is a viral illness. So in viral illness you should not be taking antibiotic. So do not take antibiotic, and do not eat together sitting close to one another. So do not eat together sitting very close to one another. You should not be doing this because it will spread the infection. Now let us learn about Hong Kong flu. Now this is not the first time when this H3N2 is causing a problem. H3N2, which is known as the Hong Kong flu, was already a problem. It happened in 1968, 1969. It already happened. A flu pandemic happened, and that was Hong Kong flu pandemic that was caused by H3N2 virus. And basically this H3N2 strain actually descend from H2N2. It actually descend from H2N2. So from there, by the help of antigenic shift, you have learned in microbiology that there is a property of this influenza virus that it can cause antigenic shift. By antigenic shift mechanism, H2N2 has become H3N2. Now this H3N2, which is known as the Hong Kong flu, it has already caused flu pandemic in 1968 and 1969, and it has killed 1 million of people worldwide. And now you remember, it generally happened, it happened in the Hong Kong and other places in United States also. Now it is happening in India. So basically you can see this picture. This picture is actually showing you the Hong Kong flu in 1968-69. In those days, how this doctor, you can see the general physician is treating the patients. There is a long queue of patients who are having this Hong Kong flu. And nowadays India is also having this Hong Kong flu H3N2. Now let me tell you about the treatment. You know what? Because so many people ask about the treatment. The treatment is Tamiflu. What is Tamiflu? Tamiflu is a brand name. It contains oseltamivir phosphate capsule. So it is oseltamivir. This is the drug, oseltamivir. And this oseltamivir is also used in swine flu treatment. You remember, in swine flu also we use oseltamivir, and here also in H3N2 influenza flu we will also use Tamiflu, which is oseltamivir phosphate 75. You can see the picture, oseltamivir phosphate. So this is the end of this video. If you like this video, please subscribe our channel. Our channel is for the MBBS students who are in first year, second year, third year, fourth year, whichever year you are, please subscribe this channel. It will help you in your studies. And please write down in the comment section below.